America's flattened the curve. The task force says the worst is behind us as long as we stay vigilant. And we'll be able to open up slowly and safely in phases. And this week, some states started to dip their toes in the water. Earlier, I spoke to White House Coronavirus Response Coordinator, Dr. Deborah Birx. The Vice President said the other day that Memorial Day, which is basically in a month, we will have turned the corner on this virus and will be in a much, much better place. Is that your assumption as well?
We believe that both the hospitalizations, the ICU need, and frankly, the number of people who have succumbed to this disease will be dramatically decreased by the end of May. The cases are a different issue because now as we're expanding more and more testing, and remember our testing was very much prioritized to people who really needed it for decision making, to people who were in the hospital, people who were sick, frontline responders and nurses. As we expand testing more and more into the greater community with much less symptoms, we'll see cases and additional cases, but we believe that those will be identifying the cases that may have been and are currently circulating in the community, but maybe in that more asymptomatic or very mild state that we really want to understand.
So how costly was it that the Chinese government wasn't open and honest with us in the very beginning? It must have been, what, a month, 2 months that we lost because of the Chinese?
You know, I think there are legitimate questions that need to be posed about what did the epidemic really look like in China. I still can't tell you that. I can't tell you how many people were infected, how many people were asymptomatic. I think all that we've been really told are the limited number of cases and the limited mortality, which doesn't match any other expansive epidemic for the first time this virus sees a population. So we need to understand, were they genetically unique, or was there a lack of transparency and reporting?
It's a very diplomatic answer, and I can read between the lines, and I appreciate your honesty. Some criticism from some precincts says that the president does not listen to science and was too slow in confronting this virus. Do you agree with that or not?
Well, I arrived on the scenes the 2nd of March, and I can tell you throughout those 7.5 weeks, every piece of data that we get to him, he looks at, he talks through, he asks questions, and he asks questions that shows that he understands the data. We have to understand, public health charts are very much like economic charts, and so he has a strong foundation in data in general, and so being able to explain to him what's happening in the United States, county by county, and he really likes to see the data in a very disaggregated way. He wants to know what's happening at the county level, at the community level, at the state level, and what's happening globally. So he's assured them that we're learning from others as they move through this, and we get reports daily on how the other countries are handling opening up, and we're tracking very closely how the states are doing as they open up their economies. And that's integrating that data every day for the president and vice president.
Because Dr. Fauci said that whenever you guys have gone to the president with a serious scientific recommendation, he's absorbed that and taken action.
That is absolutely correct.
We heard from DHS, one of the scientists on Thursday, say that sunlight, increased temperature and humidity could have an effect on killing the virus in the air, on surfaces. And the president's spitballing and he's asking questions. Would it be possible to maybe target the virus through a cure using certain ingredients or using sunlight? You didn't believe the president was putting anybody in danger, did you?
No, when he gets new information, he likes to talk that through out loud and really have that dialogue. And so that's what dialogue he was having. I think he just saw the information at the time, immediately before the press conference, and he was still digesting that information. The president has always put health and safety first. I think you can see that in the way that he was supportive of slowing the spread guidelines, knew the impact that that would have on the economy, and knew clearly what impact it would have on the economy. Yet he realized that the health and safety of Americans was his #1 interest and responsibility, and that's what he did first and continues to do as we begin to open up.
You probably never imagined you'd be doing this much television. You're doing network, you're doing cable, you're doing print. You're basically there every day during these task force briefings in front of the press corps. Do you believe the media in this country has been fair throughout this pandemic?
Well, you know, I've been privileged to do media all over the world. People may not have seen me before because it's been primarily in South Africa and Asia, because I've been working on vaccines and therapeutics and pandemics around the globe for a number of years. I think the media is very slicey and dicey about how they put sentences together in order to create headlines. I think, you know, we know from millennials and other studies that some people may only read the headlines, and if there's not a graphic, they're not going to look any further than that. And I think we have to be responsible about our headlines. I think often the reporting may be accurate in paragraph 3, 4, and 5, but I'm not sure how many people actually get to paragraph 3, 4, and 5. And I think the responsibility that the press has is to really ensure that the headlines reflect the science and data that is in their piece itself.
Dr. Birx, thank you so much for everything you're doing to keep everybody healthy and clean and safe, and we're grateful for your service.
Thank you. Thank you for having me.